Hello and a warm welcome to everybody joining us today for our 7th annual ISNTD Festival. It's a beautiful, crisp, sunny March morning here in London. So the sun is shining for hopefully the next 2 days, which is really packed in terms of a packed agenda, some really interesting, quite frankly, amazing communication approaches in terms of getting closer to communities, bringing that lived experience out, getting healthcare messaging to and from the affected populations when we're talking about NTDs or indeed the kind of larger, broader global health perspective. I wanted to keep the introduction pretty brief. My name's Cameron Rafiq. I'm one of the co-founders along with Marianne Compere and actually comms director here at the International Society for Neglected Tropical Diseases. I'm joined for the opening that we have. We wanted to kind of set the landscape, set the scene. So we thought, who would be better? There would be no one better than the WHO itself, the World Health Organization. And we are absolutely honored because at quite short notice, with lots and lots of varied commitments, both Dr. Gabriella Stern and Gilles Reboux have agreed to join us this morning. So we're going to go into a deep dive. They don't need much of an introduction. Anyone in this space is fully aware of who they are. But Gabriella Stern is the Director of Communications for the WHO, and Gilles Reboux is one of the heads of the AV production unit, and actually helps one of the directors in terms of the running of the Health for All Film Festival at the WHO as well. As I say, they don't need much introduction, but a quick hello to both of you there. I don't know if you want to just quickly say a couple of quick hello or something like that, and we'll move straight into the kind of the conversation, if that's
sure.
Okay.
Can you hear me?
Yes, we can hear you perfectly.
So I'm Gabriella Stern. You can call me Gabby. I'm the Director of Communications, as you said, at the World Health Organization, based in Geneva. I'm a former journalist. I've been at WHO since around this time in 2019, right in time for COVID. And Gilles, I'll let Gilles say a few words, but I just want to say he is the creator, founder, progenitor of the Health for All Film Festival, which has been running now for several years. And it's quite innovative, and hope you all will tune in when we announce this year's winners in June, I believe. And also encourage short filmmakers or makers of short films to participate in future years. Gilles, over to you.
Thanks, Gabi. Yes, hello, everybody. Indeed, I am Gilles Reboux. What to say? In addition to being the leader of this Health for All Film Festival that WHO launched on first edition was 2020, we are in the 4th edition. And before the announcement of winners that Gabi just mentioned, the 7th of April, which is World Health Day, the anniversary of WHO, we are going to release the shortlist of films for this year's competition. So I'm working hard on the selection at the moment with 120 volunteers in the staff have helped on that. We receive 1,000 films every year. I'm going to speak later more on details on that. But my experience is before doing that is as a producer. I've directed filming missions in about 50 developing countries. A lot of times close to communities, filming people in villages and neighborhoods in cities. So many times on health issues, of course. So yes, I'm happy to share my experience this morning also regarding this filming and production activity.
Brilliant. Thank you very much for that, both Gabby and Gilles, and also thank you to the lovely audience that are joining us from across the world. We often talk the rationale for our festival. We've heard the 7th coming up for the 7th of April for the WHO's anniversary, and all of the prep that you're doing for that. The rationale for our kind of approach to this, and this is the 7th annual festival, has always been to open that black box between results coming out of an intervention, research, that kind of chasm, that abyss, and then that kind of leads to before we get to change at policy or community level. So that black box in the middle, what is that? So we opened it up and we kind of felt and looked at that very carefully. And it really was a communication bottleneck, if you want to call it that, or at least the skill sets were out of the kind of remit of hard science, as it were. So we wanted to open that and kind of not just pay tribute, but to explore that somewhat in this. So that's the kind of basic rationale, the fundamental rationale for the next 2 days. And on that basis, what I wanted to do was ask both of you, I guess, a question or first kind of point in our kind of conversation, is from a kind of broad perspective. And what I wanted to get from you is, what is the WHO's perspective on the role of communication within global health and NTDs? We talk of, in your viewpoint, what is that role? I'd like to ask that to Gabby first, as Director of Communications.
So the big question, communications is a lever, a driver, an accelerant for WHO's goals, right? So we exist to help achieve the organization's goals, and in our constitution, the vision is to help all people achieve the highest attainment of health. And then under our current DG, Dr. Tedros, we have what we call the triple billions strategy, which is to bring billions, several billion people, 3 billion people into different levels of health. I think I was thinking about your image of a black box. I think I see it as a long kind of, it's as if you're on a track, a running track, and you're running really fast, everything's moving fast, and you have a long distance to go. And how do we operate at top speed, which is what communications departments invariably do? We are always incredibly busy, we're moving fast. We are trying to be proactive and tell stories and talk about health, but invariably we're having to be reactive. Things are coming at us. Questions from media, comments from the public on social media, criticisms, trolling, misinformation, falsehoods, and so on. And that's external. And then internally, we have, every organization has an internal constituency, their employees, their partners. So when you're the head of a communications department, as I am, you very much feel like a frontline worker who's having to move fast in a somewhat chaotic environment, having to be both proactive and reactive. And then to kind of get to your point, how then do you take these profoundly important health issues like these neglected tropical diseases, NTDs, or rare diseases, or whatever? How do you then actually enlighten people about the issues? How do you partner with people who are either health workers working on the issues, or scientists, or public health workers, and most importantly, communities who are dealing with, who are living with these diseases? How do you actually bring these issues to life in a way that helps them, advances science, advances healthcare, and advances solutions? How do you do that in this crazy environment? And I'm here to say I don't have the answers.
Yeah.
What I have is our story, our experience of how we try to juggle these rather competing forces at any given time. I can go on and tell you a bit about our experiences, or do you want to ask me a question?
Well, I think you kind of answered a bit of that in quite a nice way, in terms of you brought it into the communities, because I was going to ask about how that then translates in terms of getting those elimination control targets. What type of engagements do you envisage? But I mean, I can flip that because you mentioned something there, and I think that's the kind of traditional positioning of communications, if we're honest, a kind of reactive stance, right? So I wanted to flip that to Gilles and just engage him there. That from your perspective, how is there a move that you're overseeing in your role from, let's say, this reactive traditional position to more, you mentioned short form and this army of volunteers and helpers that you've got, into a more proactive form? Gilles?
Yes, thank you. Well, it's when I think about your first question on global, the role of communication on global dimension, global health and entities. And in fact, I want to say a few things. On the film festival experience, we receive, as I said, about 1,000 submissions on average, a bit more than 1,000 submissions every year. And we receive a number of stories about NTDs, different diseases, but not enough, I would say. And but we have managed in our past editions to select about 7 stories, maybe out of 45, 50 stories every year. We've managed to have 7 stories on NTDs, so we could have much more. And I'm really engaged to select more if I would have more submissions, good quality submissions. On the rituals production, I'm speaking more, of course, the audiovisual dimension of communication here. But I think the audiovisual dimension is comparable with every social media activities or mass media, traditional media activities we do. I think with NTDs, we have to be careful about the statistics, the viewing, the audience statistics, because obviously, because they are neglected, there's not a lot of interest from the audience. We have to target more, and we have to make proactive efforts to reach the audience when we speak about NTDs. I would say it's much more difficult, I think, than communicating about COVID or about mental health or about major longer diseases like HIV/AIDS, where we have had a lot of mobilization since the 80s, 90s, and so on. So for NTDs, maybe apart malaria, which is a very well-known problem in the world and common to so many countries, but the other diseases are maybe more neglected, and that's a question, I think, how to reach, and we can develop that later on in the morning, but how to reach the audiences and how to mobilize audiences who don't know anything about these diseases and to make them aware that they should be concerned.
That's a great answer, and I think we're going to see a lot, as you said, a lot of that in the follow-up throughout this session, if not throughout the whole 2 days. But I think I'll put that question back to Gabby, because you mentioned the communities in your answer and how we're going to engage and how to kind of get close to them. So I wanted to kind of put something in there. How do you view the evolution of citizen science in this kind of setting of communications, as mobile phones are everywhere, as social media is everywhere? A lot of these populations are proven to be highly sociable, highly mobile, especially in cases in settings such as dengue as an example, chikungunya, these kind of very social, very mobile cohorts of people, but are suffering from these diseases. How do you view, Gabby, from your kind of overarching perspective? You must see a lot of action, all of that, in terms of the communication flow from a global health study, in terms of the evolution of citizen science and the role of the community in this setting.
Our strategy envisions more and more user-generated content. For a few reasons. Practically, a department of communications in a health organization cannot possibly tell all the stories that are out there. But also, we don't own the stories. People own their stories. And so there's an increasing effort under Dr. Tedros to engage with really large networks of partners. For instance, he has massively increased our work with youth groups, with youth organizations. I mean, I don't know if you all know Vivian Joseph. She'll be speaking at your conference, but the SABC group, I mean, there's just so many groups that we're working with. And when we say we're working with them, we are learning as much from them as they are from us, sometimes more, often more, I think. And I wanted to bridge to something, which is one of the things I learned during COVID and being director of communications during COVID is that actually in many contexts, normal people are get ahead of, and are wiser and more practical than experts. Oh. And so for instance, in COVID, in the early weeks and months when the scientists were trying to understand this new pathogen, how did it behave? How did it transmit? What should people do to protect themselves and their loved ones? How to protect health workers so they can protect us? While the scientists and other experts were trying to understand this, normal people around the world took matters into their own hands and did very practical, common sense things to protect themselves, putting on masks in communities, distancing themselves, staying at home, opening windows. And for me, this was a revelation because being relatively new to WHO, I had kind of come with the idea that I was joining an organization where experts opine, experts say what's what, and then people are invited, encouraged, asked to do things. But in actual fact, what I learned and what our experts learned is it's a real two-way street. They will learn from us. People will learn from us because our experts do have specific specialities and so on and tools. But we will and do learn from people out in the world in their contexts. So translate that to how I think about the Department of Communications at WHO is we are, through social media listening, media monitoring, conversations, people like me speaking with people like you, we are increasingly integrating into our communications planning and the products we make, videos, animations, stories. And we're trying not to operate as if we're sitting in an ivory tower, yeah, but actually trying to benefit from and almost it's really more a matter of sharing stories rather than us creating stories and then bestowing them upon the world. I hope that makes sense.
Now that makes a lot of sense, and it's actually very encouraging in terms of the future. I suppose one of the in terms of empowerment of these communities and this user-generated focus. So I suppose we could flip that into, you mentioned product yourself, Gabby, there, but flipping that to Gilles. I'm going to say the word, it's in some quarters not very well accepted, but TikTok and the short form, do you think the kind of digital arena in terms of the production values and that kind of scene apply to the actual community itself in terms of user-generated content? Have you seen much of this coming through in the last few years, or how do you anticipate kind of moving forward how that's going to evolve? Gilles, the TikTok question, I guess you could call it.
Yeah, well, as Gabby said, I am in the audiovisual team. I'm not in the social media team, but of course we work closely together with the social media colleagues in the Department of Communication, and especially providing the video content to them. So I'm not specialist of TikTok, and I'm more on the YouTube platform for the audiovisual team. But what I would like to say about this question is, to me, as I was saying at the beginning, a bit earlier, we have to be proactive with different audiences. Yeah. So speaking of NTDs, if we want to reach the youth, I think TikTok certainly is a very popular platform with the youth. I know in social media, the youngest people were on Facebook some years ago and have moved to Instagram, and now they moved to TikTok because they want to be between themselves in the youth. So that's and every platform on social media has its own type of video content. In terms of format. Instagram, you're limited to 1 minute. Twitter, you're limited to 2 minutes 20 seconds. TikTok, it's a specific also style. So ideally, we should produce different content for different platforms depending on the audience we want to reach. If we want to reach researchers on NTDs or doctors in their health centers, I'm not sure TikTok is the best, but if we want to reach the youth in remote areas, where, and I think that was when I was filming on Boruli in Cameroon about 10 years ago. I was so, because I started my career in Cameroon for 2 years as a volunteer for a French NGO. And I went back 10 years ago there and was so surprised in the remote forest of southern Cameroon to see that there were an antenna for smartphones in every remote area. But the roads were still damaged and not easy to drive on, but the smartphone were working. And I think we have here a strong power with social media to reach the remote people and to convey some messages to them and some stories.
And Gilles, don't forget that you have a category in the Health for All Film Festival of social media films. So
yes.
And just to say, WHO, we have accounts. We have TikTok, Snap, Insta, LinkedIn, Twitter, Facebook, and so on. So we are on all these platforms producing content, videos, and other for all these things. So, for instance, when we had the monkeypox, when we have the monkeypox public health emergency of an international concern, which is ongoing, to reach affected communities, we did a lot with TikTok, actually, and it was quite successful. So I think the answer is yes, all of the above.
That's a great.
May I ask? Sorry.
Yeah.
Okay. Sorry to interrupt you.
No.
I just a quick one. I think what is important to underline when we speak about NTDs, since they are not so well known, when we have to go for a platform where the format has to be very short, like Instagram or maybe TikTok. But then when it's only a short format, you can't explain a lot, of course, by definition. So we have to be careful that for NTDs, maybe we need also to influence some leaders with longer format, giving more information. I don't know. That's something I would like to discuss with you all this morning. Is about the formatting is very important when we want to explain something versus having a short message and a short format.
I think that's a fantastic set of answers there. I think it's been music to the ears of many of the people that are tuning in, because the next part of this session is going to look at exactly this, how to engage those communities and what formats and production values and narratives. I'm sure that's all going to come out. One thing that's kind of come to the surface here, Gabby, you mentioned this ivory tower, and as you first came, the experts, but moving away from that. And then Gilles, you also said that we have to actually, at some point, you have to involve them as well in terms of, you have to educate the people as well as disease awareness. You do need the experts as well. My question kind of from that is there a role for mentoring in terms of, firstly, let's say the production values, but then also the expertise that is certainly locked in the WHO, absolutely. And so, is there a role for a mentoring role for the WHO into these communities of what the disease is, transmission, all of it, and then the actual translation of that, as we're kind of discovering this morning or throughout the next few days, into film, short format, long format, social media, whatever platform, whatever omni-channel, whatever channel, because is there a role for mentoring? Gabby?
Yes, the WHO, we have embarked on a massive effort to strengthen our country offices. I think this is going to define Dr. Tedros' second term. And so currently WHO has about 150 offices So we're in most countries, or most member states. We have 194 member states. We're in 150 or so. But typically, the country offices are pretty small and under-resourced. And we're flipping that around, and there's this massive effort to invest in country offices as opposed to hubs like the Geneva headquarters or the 6 regional offices, etc. And my strong sense of this country strengthening, and it's happening now with a real shift in resources, but also empowering people in the country offices. Any large organization can become rather hierarchical, just because hierarchies are kind of an efficient way for people to engage with each other. But hierarchies don't foster empowerment of people at the ground level. And the more that we flip the hierarchy and encourage and empower people in country offices to do what they joined WHO to do, the more we'll be able to actually do mentoring in communities. We do a lot of it right now. I mean, so much of our work is in the field. But I see us doing more and more of that. And the other thing I wanted to say is this massive, the other thing I mentioned, which is the massive effort by the Director General to create huge partnerships, such as the ones with the youth groups. The biggest youth organizations in the world are our partners. The more we can mentor the mentors who can then mentor. In other words, there has to be a kind of tree. Yeah. This is a big world. There's 7-8 billion people. Yeah. WHO itself is never going to be able to do all of it. But what we can do is through our partners reach lots and lots of people. So I hope that helps. But what you're talking about, mentoring, is really captures. And the other thing I wanted to say is we need to be mentored. When Vivian asked me recently to mentor her, I thought to myself, well, I want her to mentor me. Because the thing about someone like me, you can see I'm old, I've been around, I've done a lot of things. But certainly a field like communications that's constantly evolving. The advent of social media has really blown up traditional communication. The shifts in the news media, the decline of the traditional business model that has really threatened and altered how news is done, and so on. All of this means that longstanding communications practitioners, we need mentoring. We need to stay fresh. We need to learn. So I actually think that on the one hand, you're saying we should be mentoring, or should we be mentoring? On the other hand, I actually come back to the idea that we need to be extremely good listeners and empower people who, in the old-fashioned sense, would be our students. We would be mentoring them. Quite the contrary. It's a two-way street. Yeah.
And that's an absolutely superb answer. And actually very, very encouraging. You mentioned Vivian Joseph. Obviously, she's going to be in the panel later on in the proceedings. But I mean, to hear someone from the WHO Director of Communications talking about being listened to in the two-way process, it's very, very encouraging.
Well, I mean, just to jump in, we had a friend named Maximilian Godwin, right? Yeah. So he was a young guy. He was 23, and he was in a car accident in December, I think it was, and died. He was a young life force who was involved in youth advocacy around health issues in parts of Africa, including around neglected tropical diseases. And during the brief period when I interacted with him over the past year, I learned more about about really community engagement around health issues than I would ever have learned from anyone anyone in a traditional organization, you know, and whether it was the World Health Organization or in previous jobs. He was Tanzanian.
Yeah.
He worked with a network of youth groups with NTDs. This is the only way that the World Health Organization or any other institution, the only way we're going to have impact
Yeah.
and help people is
Yeah.
through a network effect. By
Yeah.
partnering with you, with everybody at this conference, it has the only way to scale up in a big, complicated, messy world is for people to join hands and work together and to share content. You know, if anyone on this call, I mean, in this meeting, ever has a great piece of content, a video, a story, whatever, that captures something that you think the World Health Organization should be amplifying, send it to me or Gilles. I'll put my email in here. No organization can solve anything on their own, and no organization can make all the content that needs to be out there to tell the stories of people's valor, people's strength, people's needs.
And that's a great answer. And I mean, just echoing that, Maximilian Godwin was a very close friend of mine, a personal friend of mine. We go back quite some time, and I was very lucky enough to be with Gabby on the memorial lecture that was put together by SADC Youth in terms of honouring his passing. Very, very sad time, but as you say, all of us have had our lives enriched by that process. And to distill that into the communication modalities that we're going to be talking about, I think is absolutely vital. And you were saying you're old, but I think communications is the elixir of youth because of the vibrant, dynamic nature of it. It keeps everybody, you know, young, if that's the right word, fresh. So I think that's going to really come across. I wish we had more time, Gabby, or genuinely, we could speak about this all day, honestly, because it's that important. It really is. This is the skill set that's not there, that needs to be there and needs to be brought right into the community to bring their lived experience out. We all feel that. Everybody's joining us for that. And we have to kind of move on to the next kind of session. And when mentioning people, we've been joined by people across the world, really. Just a few shout outs. So we mentioned Dr. Balugan from the Federal University in Nigeria, Kathleen Gilas from the Global Schisto Alliance and the NNN, also Anna Jorgensen from the Unlimited Health in London, Millicent Opuku from Australia, La Trobe University in Australia, Reboux Ibrahim from the FGS Society of Nigeria, Dr. Rod Dillon, who's going to be presenting later with Fia Cruz later on in the program, Miriam Keshinro from the State House Abuja in Nigeria, all the way from Mozambique, Dr. Escola, NTD's coordinator at the Health Research Center there, from the Côte d'Ivoire, Dr. Koulibaly, who joined us quite a lot in terms of, it's very nice to see you there, Dr. Koulibaly. Thanks for joining us for our Connect series. Ruth Lorimer from the London School here, London School of Hygiene and Tropical Medicine. Alan Mee, who's popped up as an actual speaker, but he's going to be speaking. We're also attending as well. You cloned yourself there, Alan. Amazing stuff. Great. Reboux again. Katie Athersuch from the Medicines Malaria Venture in Geneva. All sorts of people. Jeremiah Altakunabo from Nigeria, public health professional. Patrick Wilson from the NIHR here in the UK. I just wanted to give a quick shout out to Emilio from the Kembise Health Research Center. Northeast, Southwest, people are here. Youth Platform, Julius Mohundi. And it's going to get bigger and bigger through the day as different sessions enroll. But I think we really are going to encapsulate what you said and take that to heart, both Gabby and Gilles. I'm afraid we're going to have to, well, I'm proud to say we're going to move to the next session now. I'm sorry that you have to go, Gabriella, or if you can stay, I'll just mute you and you can stay. But I think I'm going to bring to the floor, so firstly, digital round of applause for everybody. Thank you both, Gabby, and thank you, Gilles, as well. Yeah, thanks a lot.